Welcome back, Straight Talkers. Today I'm going to talk about conduct disorder and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Conduct disorder is listed under the section Disruptive, Impulse Control, and Conduct Disorders in the DSM-5. And the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, is a textbook produced by the American Psychiatric Association. It's used by healthcare professionals, and it contains descriptions, symptoms, and other criteria that are used for diagnosing the various mental health disorders in both children and adults. It is estimated that around 4% of kids and teens meet criteria for conduct disorder, and the onset can occur as early as the preschool years, but the first significant symptoms usually appear somewhere between middle childhood to middle adolescence. And many children who develop conduct disorder have also at some point been diagnosed with oppositional defiant disorder during their earlier years. So how is conduct disorder diagnosed clinically? There are 3 criteria that we psychiatrists take into consideration, and these are listed from A to C in the DSM-5. So let's break these down further. Criterion A, which is the essential and core feature of conduct disorder, states that there needs to be a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate societal norms or rules are violated. And this is manifested by the presence of at least 3 of the following 15 criteria in the past 12 months from any of the 4 major categories, with at least 1 criterion being present in the past 6 months. So the first group of symptoms fall under the category aggression to people and animals, and this consists of 1, bullying, threatening, or intimidating others. 2, initiating physical fights. 3, using a weapon that can cause serious physical harm to others, such as a bat, brick, broken bottle, knife, or gun. 4, being physically cruel to people. 5, being physically cruel to animals. 6, stealing when confronting a victim, and this includes mugging, purse snatching, extortion, and armed robbery. And then 7, forcing someone into sexual activity. The second cluster of symptoms fall under the category destruction of property, and these include, continuing our symptom list, number 8, deliberately engaging in fire setting with the intention of causing serious damage. Number 9, deliberately destroying others' property in ways other than by fire setting. The third collection of symptoms fall under the category deceitfulness or theft, and these include 10, breaking into someone else's house, building, or car. 11, lying to obtain goods or favors or to avoid obligations. 12, stealing items of non-trivial value without confronting a victim. So this would include things like shoplifting or forgery. The fourth and final group of symptoms fall under the category serious violations of rules, and these include number 13, staying out at night despite parental prohibitions, beginning before the age of 13 years. 14, running away from home overnight, at least twice while living in the parental or parental surrogate home, or once without returning for a lengthy period of time. And number 15, being truant from school, beginning before the age of 13 years old. Criterion B states that the disturbance in behavior causes clinically significant impairment in social, academic, or occupational functioning, while criterion C states that if the individual is aged 18 or older, right, criteria is not met for antisocial personality disorder. If I find that a child or teen is meeting criteria for conduct disorder, the next thing I will do is go through the various types of specifiers to clarify the diagnosis further. The first specifier has to do with the age of onset of symptoms. Childhood onset type is when an individual shows at least 1 symptom characteristic of conduct disorder prior to the age of 10 years. Adolescent onset type is when an individual shows no symptom characteristics of conduct disorder prior to the age of 10 years old. And the last type is unspecified onset, and this is when the criteria for a diagnosis of conduct disorder are met, but there's not enough information available to determine whether the onset of the first symptom was before or after age of 10 years. What we typically see is that individuals with childhood onset are usually male, frequently display physical aggression towards others, have disturbed peer relationships, may have had oppositional defiant disorder during early childhood, and usually have symptoms that meet full criteria for conduct disorder prior to puberty. These kids also are more likely to have concurrent ADHD and other neurodevelopmental difficulties. Those with adolescent onset type tend to have a more balanced male to female ratio, are less likely to display aggressive behaviors, and usually have more normative peer relationships. And when comparing those with childhood onset and adolescent onset further, what we typically see is that those with childhood onset are more likely to have persistent conduct disorder into adulthood than those with adolescent onset. After a child or teen is diagnosed with conduct disorder, I will always complete a thorough suicide risk assessment, as suicidal ideation, suicide attempts, and completed suicides occur at a higher than expected rate in individuals with conduct disorder compared to those without it. Also screen for specific learning disorders, ADHD, oppositional defiant disorder, mood disorders, anxiety disorders, and substance-related disorders, as those with conduct disorder have been shown to be at higher risk of having these other conditions. As teens enter adulthood, I will also keep an eye on whether or not their symptoms persist to the point where they meet criteria for antisocial personality disorder. Thanks for watching this video. Now head on over to the next one to find out more ways that you can help your child live their best life.